When it comes to food, sometimes the healthy choice is not the most accessible choice, and that is a problem.
Healthy diet's critical for prevention and management of diabetes, hypertension, other chronic health conditions. There is an organization that's working to break those barriers and fill those gaps so that those healthy food choices are within reach. With us this afternoon to tell us more about this effort, this is Catherine Rogers. She's the Director of Community Health Initiatives for Tidal Health, along with Peggy Geisler, who's the Executive Director of the Sussex County Health Coalition. Thank you for being here this afternoon.
Thank you.
Wonderful talking to you. Okay, so we talk about this all the time. We always say healthy eating, exercise. Does it really, is that a critical step when it comes to taking care of chronic illnesses?
Absolutely. I mean, you know, we have 41% of our Delmarvans are hypertensive. 41%. 28,000 diabetes, another 28,000 pre-diabetic.
Wow.
And you know, as simple as getting moving and making some better choices in eating and low sodium can really make the difference.
So why do you think it is folks aren't making those choices?
I think it's not always the easy choice, right? I mean, we don't plan. Like, you have to actually kind of plan it. You have to buy your food a little bulk. You have to cook some meals. And we're always a community on the go. We've got kids going to this, we're going to that. You know, there's a lot going on. And sometimes it can also be we don't have the money to pay for those things.
Okay, so you've got barriers. How is the Sussex County Health Coalition helping break those barriers?
Well, with great partners like Tidal Health and a number of other partners, I think that what we're trying to do is we just put 20,000 in grants out. We've got a lot of physical activity. You're going to hear more about this. We're getting ready. Let's Get Healthy Sussex is coming in May, and we're going to be putting out service announcements. Our local libraries is going to have free yoga classes. We've got other physical activities, Zumba, free to the community through the Laurel Library.
Wow.
I think the important thing is it's as simple as taking a walk after dinner with your kids.
Yeah.
And Catherine, Tidal Health already has some wonderful programs and things that folks can access to make that first step, right?
Yeah, well, we have stuff to help people manage their chronic conditions that they already have, like our diabetes support groups that are in Seaford quarterly, but there's a lot, we were talking about the barriers and why is it so hard for people? Well, there's a lot of people on Delmarva who have a food insecurity. I mean, they don't have regular access to healthy and nutritious foods. So when somebody comes to the hospital in Seaford, we're screening them for their food insecurity. And if they don't have a regular access to healthy food, then we're ensuring that they are leaving the hospital with nutritious food and then connecting them back to community resources and community health workers.
So it sounds like you guys are doing all the heavy lifting. How can we help support the effort?
Well, I think there's a couple different things. First of all, by being here today and getting the information out, in May, we're going to be hosting public service announcements. We're going to be featuring more on DelmarvaLife. We're going to have some chef demos. But making sure that people go to your website, link to us, know what's going on in the community. We're going to ask people to sign a pledge. Do one thing to get healthier.
Okay.
Let's get everybody to think about that. I mean, when we say let's get healthier Delmarva, it's not us getting healthier. It's Delmarva getting healthier. It's whatever, you've got to play a part, right? Whether you drink more water in the daytime, whether you eat a little less sodium, whether you cut back on some of those sugars or natural sugars with fruits, we all play a role in this. And you're playing our media role, we're playing our community role, but it really is up to the individual to play their role.
And you're not asking them to sign up for a triathlon or anything, just get a little bit at a time, right?
Yeah, I think people try to do too much, right? And they get discouraged, right? How about we make small incremental changes over time? And you know what? This is about quality of life and length of life. And think about that. How long do you want to live and in what way do you want to live? And this is one way to start.
Okay, so what if somebody needs the services that you're offering?
All they have to do is reach out on our website through you guys, right?
Yeah.
Let us know on our info. You can reach out to us, let us know what's going on. We'll put you in the right direction. We'll connect you with what you need.
Wonderful. What a great effort. Thank you so much for coming in, Catherine and Peggy, and good luck with the launch.
Thank you.
Thank you.